know that feeling, the scratch in your throat, that sudden wave of exhaustion that just hits you from nowhere. You know you're getting sick. But what's really going on in there? And the biggest question of all, how long is this going to last? Well, in this explainer, we're going to trace the entire journey of a viral infection, right from that first moment to the final recovery. It feels like a total mystery, doesn't it? One day, you're perfectly fine, and the next, you are down for the count. So today, let's pull back the curtain on that tiny, microscopic drama that's unfolding inside of you. We're going to follow the whole story, from the initial invasion to the very end. You know, at its heart, it's both that simple and that, well, sinister. A virus isn't just a passive guest. It's an invader with a mission. It literally hijacks your own cells and turns them into little virus factories. And that one idea, it's the key to understanding everything else that happens when you get sick. Okay, so let's start at the very beginning. How does this whole invasion even kick off? Turns out it's a pretty clever step-by-step process that begins the second you're exposed. The whole thing is shockingly efficient. Think of your cells as houses with locked doors. A virus has a special key, which is a protein, that fits the lock on your cell's surface. And this key is super specific. It's why the cold virus has the key for your nose and throat cells, but not, say, the cells in your stomach. Once it's inside, it's a total takeover. It forces your cell to build a whole army of new viruses, and that's how one tiny invader can escalate into a full-blown infection so fast. So how do these invaders actually find us? Well, their travel routes are all around us, every single day. From the air we breathe to the doorknobs we touch, viruses are just waiting for an opportunity. Understanding these paths really shows you how connected our health is to our environment and, our everyday actions. All right, once that invasion is underway, your body starts blaring the alarms. And those alarms, that's what we call symptoms. They're not just random feelings of misery, they are your body's emergency broadcast system, telling you exactly where the fight is happening. Viruses are often specialists. They pick a target, your lungs, your gut, even your skin. And your body's response is going to look and feel totally different depending on where that battle is. To keep things simple, let's just focus on the two you're probably most familiar with, respiratory and digestive infections. We all know this feeling too well, right? It's so much more than a stuffy nose. It's like your entire system just gets shifted into low power mode. And that's your first big clue that the fight is happening in your respiratory tract. Now here's the thing about every single one of these symptoms. They're actually signs that your immune system is putting up a good fight. A fever? That's your body cranking up the heat to make it a terrible place for the virus to live. That congestion? It's the result of inflammation as your body rushes defenders to the scene. You feel bad because your body is working incredibly hard for you. Okay, let's switch gears. Unlike the slow creep of a common cold, a stomach virus often hits you like a ton of bricks. There is absolutely no mistaking when your digestive system is under attack. These symptoms are basically your body's desperate attempt to just get the invader out as fast as possible. It feels awful for sure, but it's a really powerful and effective defense mechanism. You'll notice some overlap here, like fever and chills, but the main event is clearly happening in the gut. Okay, so you've been invaded, your body is in full-on battle mode. What's next? The good news is there's a clear path back to feeling like yourself again, and a whole lot of it is actually in your hands. When you're sick, the most important first step is knowing which toolkit to open. For most of these common viral infections, your own immune system is the star of the show. All it really needs is some support from you, like rest and lots of fluids. But if things feel really severe, or they just won't go away, it's time to call on the professionals for a proper diagnosis and maybe some more targeted treatments. Now, this is really important to remember. Over-the-counter meds like these don't actually kill the virus. Think of them as the support crew. Their job is to manage the symptoms, the pain, the fever, the congestion, so you can feel a bit more comfortable while your immune system does the real heavy lifting of fighting the infection. So we've talked about what to do when the invasion is already happening. But what about strengthening your castle walls so the invaders have a harder time getting in next time? Well, that's where prevention comes in. Think of this list as the daily training regimen for your immune system. It's a mix of really simple habits like washing your hands, smart lifestyle choices like getting enough sleep and managing stress, and of course, powerful medical tools like vaccines. Every single one of these adds another layer of protection to your body's defenses. Okay, so we've journeyed through the invasion, the symptoms, and the road to recovery. Now let's circle all the way back to the question that got us started in the first place.
This is it. This is what everybody wants to know when they're stuck on the couch, feeling miserable. So let's just get right to the answer.
The honest answer is, it depends. For something like the common cold or a stomach bug, you're typically looking at a timeline of a few days to maybe 2 weeks. But there isn't one single number because viral infection covers a massive range of illnesses. Some viruses, once they're in your system, are there for good and require lifelong care.
And this is exactly why it's so important to take these things seriously. If an infection is left unchecked, or if your body just can't win the fight on its own, a simple viral invasion can escalate into something much more dangerous, affecting major organs, and in some cases, like sepsis, becoming a life-threatening emergency.
When you get right down to it, every single day, your immune system is waging a silent war just for you. Understanding the enemy, knowing the rules of the fight, from prevention to recovery, is how you become your body's greatest ally. The power to help tip the scales in your favor is truly in your hands.